Hi, everyone. It's Vrushangi Shah with the Fellowship Review through the American Journal of Healthcare Strategy. Today, I am so excited to be joined by not only a peer, but a good friend, Judah Soray. Hi, Judah. Thanks for joining us today.
Hi, Vishangi. It's great to be here and reconnect with you.
Yeah, absolutely. And I'm so excited for you to highlight your journey and talk about your fellowship experience. I know that's exactly how we connected. But let's start by talking about you. Tell our listeners a little bit about you, your educational background, where you did your fellowship, and anything else you'd want to share.
Yeah, thank you. I'm excited to join you on this podcast and speak to the listeners of this podcast. So I'm Judah Soray. I am originally from Trinidad and Tobago. Grew up in the Caribbean. I went to pharmacy school there. I actually practiced as a pharmacist before migrating to the U.S. When I moved to the U.S., I decided to switch gears and pursue a career in healthcare administration. I went back to school at the University of Central Florida to pursue my master's in healthcare administration, which afforded me a lot of great opportunities to intern at the Cleveland Clinic, which sort of opened my eyes to a career in healthcare administration and international operations. And that's kind of what drove me to apply to administrative fellowships. And so luckily, thankfully, I've spent time in the past year and a half or so at the Brigham and Women's Hospital, completing the Deland Fellowship in Healthcare and Society. And that's taken me or brought me to where I currently am today in my role with Beth Israel Lahey Health.
That's incredible. And, I'm so excited to delve into the fellowship experience as well as your internship experience. But one thing you said really stood out to me, and it was that you were actually a licensed pharmacist. You went to pharmacy school. And a lot of healthcare administrators, they either pick a different major or have a different career prior to shifting into healthcare administration. So tell us a little bit more about that switch. You practiced as a pharmacist. And so, what kind of led you to finally make that decision and say, I'm going to go towards healthcare administration?
Yeah, that's I get this question all the time, and I think it's really interesting as I learned more about the healthcare administration field in the US. I kind of saw myself as an outlier because having a clinical background is as you mentioned, something that not many administrators do have. I thought
Mhm.
in my case, I wanted to use that to use that experience being on the clinical side, bringing the experience of of patient care, face to face interactions with patients, and being able to expand that passion that I have for improving patients' lives, but in a broad across a broader like section of patients in the healthcare industry, and I've had great opportunities to be able to do that.
Yeah, absolutely. It sounds like it. And I'm sure your clinical background 100% helped with, utilizing some of those transferable skills into the administrative world. And I think it's so incredible that you had the opportunity to work at such a phenomenal organization, the Cleveland Clinic. So why don't you tell our listeners a little bit about the internship experience? Tell us a little bit about the projects that you did and, maybe what were your
Yeah.
favorite parts of that internship?
Yeah, so I was a summer intern at the Cleveland Clinic, and specifically I was embedded in international operations, and I worked with the director of patient experience, who was a phenomenal mentor and a preceptor during that internship. I think she allowed me the opportunity to kind of explore international operations and to explore Cleveland Clinic to the best
Yeah.
to my ability, and she allowed me the room to do that. Some of the projects I worked on during that internship were actually they were primarily in patient experience. So we worked on analyzing 2 years of use skip data. So that's if you guys are know of it or have heard of it, but it's the International Patient Program kind of survey format that is led by NCHL. And
Mhm.
so I analyzed 2 years of feedback looking at trends in that data and kind of helping to guide the path forward for her and for her team in terms of what they would take on as projects. So areas of strengths and areas of opportunity that they can use to help guide their project and process improvement for the years, which I'm so thankful that I stay in touch with her. She's been able to let me know that those projects have been going really well. So yeah,
Yeah.
Dua has been fantastic to help mentor me into to where I am today.
Absolutely, it sounds like it. And mentorship will definitely be a part of this episode that we cover a little bit later. But from there, you went on to pursue an administrative fellowship. Um, could you tell us a little bit more in detail? Why fellowship? There's a lot of paths you could have taken after completing
Yeah.
your graduate program, your internship. So tell us what drew you specifically to fellowships, and then specifically your fellowship at Brigham.
Yeah, so when I kind of was wrapping up my MHA program and I interned at Cleveland Clinic, I think I took the opportunity there to network with a lot of the Cleveland Clinic fellows and a lot of them who have had just finished grad school or were just wrapping up their first year or their 1 year fellowship. And I really wanted to get a better sense of what fellowships brought to their experience, and how those fellows were able to maximize the experience, and look at their backgrounds, their education, and their on-hand experience to make the most of that opportunity and kind of propel their career. And that's kind of what drove me to apply to fellowships generally. And I think in my case I was looking for fellowships that maybe some of them that required more experience, because I brought experience where a lot of times students tend to they may just have like internship experience or maybe just a couple of years of experience, but I was looking for opportunities in fellowships where they specifically wanted fellows who had years of experience, because the fellowship was less structured and you had the opportunity to kind of shape the experience to be what you wanted it to be. And so that's kind of what drew me to the Deland fellowship at Brigham Women's Hospital. And thankfully, I was selected and had that amazing opportunity there.
Yeah, absolutely. No, it definitely, even in connecting with you over the last couple of years, it seems like it was a very rewarding opportunity for you. For our listeners, tell us a little bit more about the logistics of the Brigham Fellowship. Is there one fellow? Is there two? Is it project based, rotation based? Is it one
Yeah,
year, 2 year? All those fine details.
yeah,
Um,
yeah, yeah, definitely.
yeah.
So yeah, so the Deland Fellowship is a 1 year less structured fellowship. It is
Okay.
primarily project based, but you have the opportunity to rotate through different areas of the organization or through different areas of the operations, or whichever you decide you want to kind of learn more and immerse yourself into.
Yeah.
As I mentioned, a really unstructured fellowship, so you honestly get to shape the experience to be what you want it to be. You get to
Sure.
pick the number of projects, the scope, scale, types of projects that you want to work on, the
Mhm.
areas that you get to work on. And in that fellowship, what they try to do is match fellows who have interest areas and specific like needs of the organization to that fellowship year or that fellowship cycle.
Sure.
And yeah, I could go into more detail, but I'm sure we'll get there.
Yeah, and did you have a co-fellow? Do they always have one,
Yes.
two?
There have been years where they've had four, three, but typically these in the past couple of years it's been two.
Okay, okay. So you did have a companion, you had and tell me more about that. If you and your fellow have an interest area that aligns, is there opportunity to work on projects together, or do you kind of do your own thing?
Yeah, I'm so glad you brought that point up. So during my fellowship year, my co-fellow Jenny was the you know her,
Yes.
Frishanki. Oh my God, she was my rock during that fellowship. I would not have survived it without her. I think having a cohort fellowship, or at least a plus one for your fellowship, is
Yes.
fantastic as just like moral, emotional, physical support during the fellowship time, because it is quite stressful in that type of
Yeah.
you have to be on your A game for the entire all day every day for the entire year or however long it is. I think
Yeah.
to answer your question in terms of the interest areas, her and I had very different interest areas to start off with, although. going into the fellowship, I was more intentional in wanting us to find one area that we could get to work on as fellows. And so her and I worked really well together on a DE&I project. And so we worked on increasing
Okay.
the vendor diversity within the hospital. And
Mhm.
specifically, we tried to scope the project to be something that that we were able to accomplish in the year. So ultimately it kind of morphed into this vendor diversity project for our gift shop. And
Okay.
so we worked with finding local suppliers and local providers in the community that we can acquire and procure goods and products from to sell in our gift shop, which kind of was a really great starting point because like this fleece that I'm wearing was made by a local supplier. And
Oh, I love.
this is my Brigham fleece, you know.
Yeah.
And it's like I love wearing this. It's my favorite thing to wear because it brings back so many great memories of me, of Jenny and I being able to work on a project like that and be able to accomplish something that was worthwhile for the organization, help support the community, but it was also overall like it helped us grow together and be able to work together during our fellowship.
Yeah, absolutely. And first of all, Jenny is great. But to your point about having a co-fellow or a cohort of fellows, fellows are
Yeah.
also the ones doing recruitment. So it's so incredibly helpful to have another or a couple of other people working with you to recruit the next cohort of fellows. So I completely
Yeah.
get.
Yeah.
Um, Diving deeper into your experience as fellow, what project during your fellowship would you say was the most rewarding, one that you like learned the most from?
Oh, great, that's a great, oh my gosh. So I worked on about 7 or 8 different projects across my fellowship year, which was a lot for a typical fellow. I
Yeah,
think the one that stood out the most for me was probably the DE&I one, the vendor diversity, just because of the impact we made and the feeling of accomplishment that we had at the end of it. But in addition to that, there was another project I worked on that was like very meaningful for me reflecting back on the fellowship year, and that was being able to work on a 340B expansion program.
nice.
And it was sort of a business case that I helped to create, and the reason it was impactful is because so Brigham and Women's Hospital, if some of you may know, is part of the Mass General Brigham system, and so they're integrating with Mass General Hospital. It's still in like the middle age stages of that integration work. Like a lot of the service lines are now slowly being integrated. At the
Okay.
system level, though, the leadership are well integrated, and so pharmacy was one of those service lines or one of those areas that were in the earlier phases of being integrated. However, they
Mhm.
hadn't maximized the opportunities that they had, and so I was able to come in, using my experience as a pharmacist and
Yeah.
having that knowledge, being able to be sort of a subject matter expert in that area and kind of work with the pharmacy leaders, the business analysts, and then our pharmacy executive leadership at the system level to kind of pull together this business plan and say, hey, like if we actually retain some of these prescriptions, it works out well for our patients because they're able to, from a patient experience point of view, they could go to the clinic in the hospital, seamlessly pick up their prescriptions or have it mailed to their home, really convenient. And then on top of that, from a financial point of view, it just makes sense for the organization to retain those prescriptions and accrue some savings for the organization if we were able to do that.
I'm sure with your pharmacy background, you were like a rock star for that and all your other projects. One of the things you talked about earlier, as we were chatting, was about mentorship. So, can you please share with our listeners what mentorship is like at Brigham and especially in the fellowship?
Yeah, so in the Deland Fellowship, you are paired up with an executive leader to be your mentor. And so during my fellowship year, it was actually the chief medical officer, Sunny Epen, who was fantastic. He was well known across the entire organization as somebody who was a compassionate leader, somebody
Sure.
who in leadership meetings people would look to for answers, not just because he was a leader, but because he was a voice of reason and someone who really had thoughtful questions and thoughtful responses to the matter that was being discussed. And so I was really fortunate to have Sunny as my mentor.
Yeah.
Unfortunately, Sunny was so great that he got a CEO position and left halfway through my fellowship. So,
Oh,
but
no.
yeah, so I only had a mentor for the first half of my fellowship, and then I transitioned on to another great mentor. So I was lucky enough to have two great mentors. The second mentor I had was the chief medical officer who filled his role, Chuck Morris, who was fantastic as well. He was another awesome leader. And I
Yeah.
think in terms of mentorship, like through the fellowship, in particular the Deland Fellowship, having the mentor relationship and being able to build that organically was just amazing, because you're able to bounce ideas and bounce concerns, through this process. It's quite a stressful process, so it can be a stressful process. And I think it's really good to have that kind of support from a leader who sits in those rooms and sits in those meetings, and you can kind of talk through the ideas and talk through these decision making processes and understand, what should I be thinking, or am I looking at things the right way, or
Wow.
is there a different approach I should take to this, to if I'm posing a question in this type of meeting. So I think
Yeah.
those things are really valuable. Yeah.
Well, absolutely. And mentorship is something that I value so much, not only receiving it from, senior leaders in my life, but also giving it back to the new generation. So I think
Yes.
I love to highlight the piece of mentorship for fellowship. So, future potential fellows can know what they can find at an organization. And,
Yeah.
so tell us a little bit. This is more of like a fun, laid back question, but Boston. Tell us a little bit about kind of your life outside of the fellowship. Maybe what was your favorite part about
Yeah.
being in Boston? What should people know?
Oh my gosh. So I moved to Boston. Well, first of all, let me tell you, I rented my apartment to move to my fellowship without ever having stepped foot in Boston. So I
Okay.
had no idea. I'd never been to Boston before. I was just like, you know what? This is a great organization. This is a fantastic fellowship. I'm gonna figure it out. So let me just rent somewhere and figure out.
Yeah.
I'm that kind of person. But Boston was amazing to live in, honestly. It's got like the old world charm, but it's an American city. It's a big
Yeah.
city, but it's also not, because it's very
Sure.
walkable. It's got great transportation system. I think there's like multiple small neighborhoods next to each other, and everywhere is really like quaint. A lot of the buildings are super old. So I think it's a great city to be in, especially so because a lot of students and a lot of fellows and residents move to Boston every academic year. And so you're not going to be the only student or the only resident or fellow who's moving to Boston. You'll find yourself surrounded with a lot of other people who are in the same situation as you. And I think I thankfully had the opportunity to like connect and network with those fellows, and make the most of that experience, and stay in touch with them and kind of grow together as a cohort of fellows.
Yeah, absolutely. What an incredible experience. And, I think I've read also that Boston/Massachusetts in general is one of the most highly educated states, also in the US, and totally makes sense with the incredible colleges and universities there.
Yeah.
So I love that you had that experience. And so
Yeah.
tell us a little bit about post fellowship life. Have you stayed in Boston? What is your what role are you in now, and what's life like?
Yeah, so post fellowship, I really took some time to kind of figure out what types of roles or type of role I wanted to step into post fellowship. And so it took me a while to kind of figure out where I wanted to be, and ultimately I landed on internal consulting. So I work as a systems integration project manager for Beth Israel Lahey Health, which is the competitor health system to Mass General Brigham in Boston. It's literally across the street. My hospital is like, you could look at the other hospital across the street. And I think the reason I landed here is because the interviews that I had for this role, I felt such a strong connection with the team, and I felt like this health system, Bethesda Lahey Health, is undergoing a lot of transformation at this point in their system career and their system life, and I felt like it was just a great fit. I think a lot of the work that I do now is very similar to the types of projects I worked on as a fellow. It's system level integration project work,
Right.
and I get to bring my skill set to this team and utilize that skill set to help think of creative ideas to implement some of the work that we're doing. And so I
Yeah.
really enjoy that aspect of this job.
Yeah, yeah, how incredible. And again, so appreciative of you being on this episode. And I'm, I'm happy you got to still stay in the Boston healthcare space and kind of
Yeah.
continue utilizing your skills that you not only built over your career as a pharmacist, but, during the fellowship. And so, the question that I love to end on with all my guests is if you were to give it this fellowship advice to a prospective candidate, or if you yourself were to redo the process, what advice would you want people to really follow when going through this process and attaining a fellowship?
Yeah, that's such a great question. I think if I were to redo this fellowship process and relive my life as a fellow or as a grad student getting into fellowship, I would spend less time worrying about what people thought
Okay.
and spend more time thinking about how I can make an impact in the work that I'm doing, because I'm confident in what I do, but I personally question myself a lot of times, and it
Right.
took me quite a while into the fellowship, into my career, to realize that just have confidence in what you're doing because you're good at it,
Yeah.
and when people start recognizing that, then it kind of like it's kind of it's a feedback mechanism. So yeah, if I had to redo that, that's what I would work on.
Honestly, such great advice. Yeah, no, great advice. And I think like from what adding my 2 cents in, as a fellow, you're surrounded by some of the brightest leaders, physicians, nursing, clinical staff in general. It can be hard sometimes to speak up and have that confidence. So I would just say, absolutely be confident and speak up, but give yourself grace too. It can be intimidating occupying some of those fellowship spaces.
Absolutely. I think imposter syndrome is such a real thing. I know you and I have discussed that in the past. I
Yes.
think at the end of the day, what I've come to learn is like even these leaders, people who are CEOs, COOs, but leaders in the hospital, at the end of the day, they're all human as well. Everybody makes mistakes. Everybody has good, bad days. Everybody, goes blank ever so often. So
Yeah.
like, don't be hard on yourself because you're doing the best that you can, and you made it this far. If you're a fellow or you're in an interview for a fellowship, like you made it this far because you are good and you deserve to be there in that space.
Yeah. And on that note, what a great way to end this episode. Judah, thank you so much for all your advice and insight, and also highlighting a unique journey from pharmacy into fellowship and now as a health administrator. I really enjoyed speaking with you today, and I know our listeners will benefit a lot from learning about the Brigham Fellowship. So thank you for joining me.
Yeah, Vishanki, it's been great to join you. I hope this has been helpful to our listeners, and yeah, I'm I'm happy to if anyone wants to reach out and connect with me and hear more about or like bounce ideas off me, I'm happy to, or hear more about the fellowship.
That's absolutely incredible. Thank you so much.
Thank you.